everyone. Welcome to NSDAPS Clinic. I am Mrs. Ballesteros and I'm here to give you the NSDAPS health services for school year 2021-2022 with the policies and guidelines, health information, health protocol, and updates on COVID-19.
Let me start with the update on COVID-19. Now, what's new on COVID-19? Aside from the fact that we are still in the pandemic for more than a year now, are the variants that have been mutated from this coronavirus. The variants are named Alpha, Beta, Gamma, and Delta. Delta is the most dangerous one from India. Now, what do we need to know about Delta variant? Delta variant, known as B1617.2 variant, is a mutated COVID-19 virus which was first described in India. It is said to be associated with evading immune protection, reduced antibody neutralization, increased transmissibility, which was the Alpha and Beta variant are around 25% more contagious, while Gamma variant is around 40% more infectious. And then, what is worse is Delta is most worrisome because it is around 100% more contagious. The variant of concerns are named Alpha, Beta, Gamma, and Delta. Their signs and symptoms are generally the same, including one or more of the following: fever, cough, colds, sore throat, difficulty of breathing, flu-like symptoms, aches and pains, and even diarrhea. And here's the signs and symptoms most prominent with the Delta variant: diarrhea, black runny nose, vomiting, sore throat, headache, feeling unwell. Now, let's go to the treatment and prevention of Delta variant. The treatment and prevention of the original virus or COVID-19 and the variants of concern are not different. And here's the recommendation of the Healthcare Professionals Alliance Against COVID-19. May bakuna man na dumating, ang pag-iwas kailangan pa din. Ano ang kailangan? 4 dapat. So A is air circulation and ventilation. P, physical distancing 1 meter or more. A, always use face mask and face shield. And T, time of interaction less than 30 minutes. So what's next? Viruses will continue to mutate if they continue to spread. The best way to protect yourself and your family and community, including kids who aren't eligible yet, from Delta and future variants is to get vaccinated. One of the solutions is the vaccination program. We need to know why this vaccine is very important. Vaccines mimic the virus or bacteria that causes disease and triggers the body's creation of antibody. This antibody will help protect us once infected by the virus. The goal of the government is to vaccinate 70% of the population in order to achieve the herd immunity, so that the spread of the virus will slow down and the disease cannot spread very far that the community becomes safe. That is what we called herd immunity. The government has set the priority groups for COVID-19 vaccination program, and they are A1, medical frontliners, A2, senior citizens, A3, people with comorbidities, A4, non-medical frontliners from different sectors including uniformed personnel, and A5, indigent people. Therefore, youth aged 16 and above may have their vaccination after all these priorities has been vaccinated. And those below 16 years of age has no approved vaccine yet. So you need to stay home, but don't worry because there are ongoing clinical trials for your age group. So be part of the solution to end this pandemic so that sooner we may meet face-to-face in our school. Aside from the vaccination, it is very important for us to stay healthy during this pandemic. And here's how. Number 1, proper hygiene or cleanliness. You may have proper hand washing, at least 20 seconds, or better, 40 seconds. Hand washing is very important. Just follow the proper hand washing technique. let me give you a demonstration on how we could wash our hands properly. First, wet hands with water, and then apply enough soap to cover hand surfaces. Then rub hands palm to palm. You count 1, 2, 3, 1, 2, 3, and then right palm over left dorsum with interlaced fingers and vice versa. Just count 1, 2, 3, 1, 2, 3, and then palm to palm with fingers interlaced. 1, 2, 3, 1, 2, 3. Then back of fingers to opposing palms with fingers interlocked. 1, 2, 3, 1, 2, 3. Then rotational rubbing of left thumb clasped in right palm and vice versa. 1, 2, 3, 1, 2, 3. And then rotational rubbing backwards and forwards with clasped fingers or right hand in left palm and vice versa. 1, 2, 3, 1, 2, 3. And then rinse hands with water thoroughly. Dry thoroughly with a single-use towel or a dryer. And then use towel to turn off the faucet. And your hands are now safe. Thank you. We need to wash hands frequently because of the things that we have touched. Respiratory hygiene is also very important. We need to clean our hands after sneezing, coughing, or blowing of the nose and avoid touching your eyes, nose, and mouth. Always follow the cough etiquette. Use tissue or back of your arm when coughing or sneezing and put the tissue on the trash can right away and wash hands immediately.
Tamang paraan ng pag-ubo. Ang pagtakip sa ilong at bibig ay hindi lamang mabuting asal. Nakatutulong ito na mabawasan ng pagkalat ng mga mikrobyo o ng mga nakahahawang virus na kumakalat dahil sa talsik ng laway sa pag-ubo o pagbahing. Takpan ang ilong at bibig gamit ang braso o tissue. Itapon ang ginamit na tissue sa basurahan. Ugaliing maghugas ng kamay gamit ang malinis na tubig at sabon o alcohol-based hand sanitizer pagkatapos umubo o bumahing. Todo laban kontra Coronavirus Disease 2019.
Always wear your mask and face shield not just for your protection, but also for others. Distance yourself from others at least 1 meter. Better to have it 2 meters or 6 feet. Cleaning, sanitizing, and disinfecting are important to remove the virus or bacteria. Disinfect frequently touched objects because virus and bacteria can also be left in objects and surfaces. Number 2, proper nutrition. Boost your immune system by eating food rich in zinc, vitamin C, iron, vitamin E, vitamin A, and vitamin B6. Eat fresh foods and avoid eating canned food. Limit the intake of high sugar and salt contents. Drink 8 to 10 glasses of water to stay hydrated. Take your vitamins to increase your body resistance. Number 3 is proper rest and sleep. Sleep at least 8 hours every night. And avoid using your gadgets before sleeping, for it may interfere with your sleep due to the bright screen that increase your alertness.
What are the things you should know about getting good sleep during the COVID-19 pandemic? Stressful situation and worrying can impair sleep. Poor sleep can negatively affect mood and daytime functioning when awake. Good sleep quality and quantity is important for the immune system. It's important to maintain good sleep habits through uncertain times. So what are the benefits of good sleep? Sleep keeps your heart healthy. It may help you prevent cancer, reduces stress, reduces inflammation, makes you more alert, improves your memory, and may help you lose weight. And also, napping makes you smarter. Sleep also helps the body repair itself.
Number 4 is proper exercise. Physical activity or exercise is very important, especially now that most of us are in sedentary activities. Being active will help boost the immune system that helps fight infection and is good for mental health.
And here's an example of an exercise you can play in the video that you can follow. Let's try it.
Up next, back turns. In 5, 4, 3, 2, 1, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Rest time. You've been working out for 1 minute. Congratulations and keep going. Up next, jumping jacks. In 5, 4, 3, 2, 1, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Rest time. Good work. You're working out for 2 minutes already. Let's continue. Up next, side bends. In 5, 4, 3, 2, 1, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Rest time. You're 3 minutes in. Good job and keep exercising.
Remember, if you can have at least 3 minutes exercise every day, your immune system will be boosted. Thank you.
Number 5 is proper ventilation. Avoid crowded places, since the virus can transmit easily in close proximity. Stay in a well-ventilated room where the air can pass through. As much as possible, avoid air-conditioned room to reduce the risk of virus spreading indoors. Number 6 is proper isolation. If you feel sick or unwell, isolate yourself from others and seek medical attention. If you have the symptoms, please call before the visit and report possible case to the LGU or barangay for contact tracing. Disinfect the area and people who are exposed shall undergo 14 days quarantine with specific instruction from the health facility. Next is proper eye care. This is very important during online classes where we are exposed to radiation from the desktop, laptop, cell phones, and other gadgets. Have a bright light room for online classes with a screen distance of 24 inches or 2 rulers apart. Wear eyeglasses as prescribed or you may use anti-radiation glasses to protect your eyes. Have a correct sitting posture. During break time, take time to blink your eyes to produce tears to avoid dryness that can cause irritations. Gently massage around the eyes while resting to help the eyes relax, and take a nap after online classes to rest your eyes. So, eat healthy, live healthy, and be healthy. Now let's go to the NSDAPS policy and guidelines for students during the online learning process. Medical dental services is available through online medical consultation Mondays to Fridays, 8 to 5 p.m. to respond to the health needs of the students. And here's the procedure of the online consultation. Number 1, report your health concerns to the advisor. Number 2, the advisor will report the student's concern to the school nurse. Number 3, the school nurse will ask for the email address of the student and parent with their permission to do the online consultation. Number 4, students will now be referred to the school physician for the health concern. The online consultation may be scheduled depending upon the availability of the school physician. Number 6, the school clinic's FB Messenger account is only for Aranzan students and parents. It is advised not to share it with anyone after the online consultation. Information dissemination, updates, and health protocol to prevent sickness will be posted on the health corner of the website or FB page and through the integration on the subject areas like science, MAPE, and TLE. To help the government on the contact tracing of COVID-19, parents are asked to report to the clinic through the advisor the health condition of the student and family members. Probable or suspected cases will be reported to the Municipal Health Office for possible investigation, testing, and treatment. Rest assured that your information will be kept confidential under the Data Privacy Act of 2012. For those whose parent during the enrollment failed to go to the clinic for the medical history taking, here's the link of the Google form for the updates. Feel free to contact us at our email address nsdaps@gmail.com, telephone numbers 8941-1269 local 106, and FB page NSDAPS Clinic. Now let me talk about the MAA General Assurance Philippines Incorporated Student Accident Insurance Claim. The scope or coverage are the following. If you met an accident, even at home, like act of nature, for example, fall, contusion, bump, etc., dog bites, cat bites, snake bites, accidental food poisoning, while riding as a passenger, while operating or driving any two-wheeled motorized vehicle except driving without license, or while engaging in prohibited drugs or alcohol, or if with violations of traffic rules. Medical assistance is also given to dengue and COVID-19 cases. Here's the procedure on how to claim. Report the case to the advisor and the clinic. The parents will get the student accident insurance claim report form from the clinic with instructions from the school nurse. Accomplish the form and submit the requirements to the clinic not later than 1 month from the date of accident. The school nurse will forward all the necessary requirements to MAPSA for processing. The parent will receive a call from the clinic for the claim once approved and processed. Please bring valid ID upon claiming. So, this is the documents you need to submit. Number 1, accomplished form for personal information and attending physician's report. Number 2, written accident or incident report with the parent's name and signature. Number 3 is official laboratory diagnostic test results, all original. Number 4 is hospital billing statement. Number 5, official receipts of all bills including medicines. Here's the form of the insurance claim. Now, let's go to the NSDAPS Prevention and Control of COVID-19. Pursuant to RA 11058 and its implementing rules and regulations and aligned with the minimum standards of DOH, our school has the following policy and health protocol. Now, let us watch The video of the NSDAPS health protocol before entering the school. Reminder that only 18 to 65 years old are permitted by the IATF to enter the school, and with those with official business only. Step 1. Accomplish the health checklist from the guard and take your temperature. We have our new contactless check-in applications. You just need to download One App PH, log in and create profile. Step 2. Soak shoes on foot bath. And wash hands before entering the school. No mask, no face shield, no entry, and observe proper social distancing.
Thank you. God bless and stay safe, everyone.